Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today. In this episode, I will present one-year outcomes from the Clasp IID randomized trial for degenerative mitral regurgitation. The first author is Robert M. Kipperman from Atlantic Health System Morristown Medical Center, New Jersey, USA. This article was published in the Journal of the American College of Cardiology Interventions in December 2023. The one-year follow-up of the Clasp IID trial reveals positive outcomes for transcatheter edge-to-edge repair, TEER, in patients with symptomatic degenerative mitral regurgitation, DMR, and prohibitive surgical risk. Two approved devices, PASCAL, by Edwards Lifesciences, and MitraClip, by Abbott, show comparable results with low rates of mortality, sustained improvements in mitral regurgitation, and positive effects on quality of life. PASCAL-treated patients not qualifying for randomization due to anatomic considerations also experienced similar benefits and were included in an associated registry. The findings, presented at TCT 2023, advocate for the advancement of mitral transcatheter edge-to-edge repair as a crucial treatment option for high-risk degenerative mitral regurgitation patients. The Clasp IID trial, conducted at 54 sites, included 300 high-risk patients with significant symptomatic degenerative mitral regurgitation, randomized to PASCAL or MitraClip. Primary endpoints were major adverse events at 30 days for safety and the proportion of patients with mitral regurgitation graded as 2+ or less at 6 months for efficacy. At the one-year mark, both devices demonstrated high rates of freedom from major adverse events, all-cause mortality, cardiovascular mortality, and heart failure hospitalizations. Substantial reductions in mitral regurgitations were sustained, with most patients achieving mitral regurgitation grade 2+ or less at 1 year, showing non-inferiority of PASCAL versus MitraClip. The results support transcatheter edge-to-edge repair as a crucial treatment option, and the presence of multiple devices fosters competition and encourages further developments in the field, providing valuable options for clinicians treating this patient population. These significant findings resulted in the approval of the PASCAL device by the Food and Drug Administration in the United States for this specific indication. We anticipate further information on long-term outcomes and potential cost differences. Additionally, we are awaiting data related to patients with functional mitral regurgitation.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.